Have you ever paused to wonder if misplacing your keys or stumbling over a word could be more than just a fleeting moment of forgetfulness? As Dr. Rachel from Vital Eternity, I'm here to pull back the curtain on dementia, a condition that affects over 55 million people worldwide and isn't just a byproduct of aging. This progressive neurodegenerative disease can start silently, decades before symptoms become obvious, quietly reshaping lives. But here's the good news. Spotting the early signs can empower you to take charge of your brain health, slow cognitive decline, and live with vitality for years to come. Let's dive into 6 subtle yet critical warning signs of dementia. Explore classic symptoms and uncover practical science-backed strategies to protect your mind. By the end, you'll be equipped with the knowledge to act early and make a lasting difference. Imagine noticing someone you love walking differently, taking shorter, hesitant steps, dragging their feet, or struggling to balance. You might dismiss it as just getting older, but these changes in posture, gait, or coordination can be early whispers of dementia. The brain is the command center for movement, and when cognitive functions begin to falter, motor control often follows. You might see someone stumble more frequently, lean to one side, or develop a hunched posture. Simple tasks like holding a cup, buttoning a shirt, or using utensils can become challenging. These shifts may seem minor at first, but they can signal neurological changes that, if ignored, increase the risk of falls and mobility issues over time. Paying attention to these subtle cues could be the key to early intervention, helping you or a loved one maintain independence longer. Dementia doesn't just cloud memory, it can transform how you perceive the world around you. Sensory changes are often overlooked, but can be powerful early indicators. Picture someone misjudging distances, spilling liquids while pouring, or struggling to navigate stairs. These signs point to declining depth perception or spatial awareness, both tied to deteriorating neurons in the brain. You might notice a loved one bumping into furniture, getting disoriented in crowded places, or even losing their sense of smell, a lesser-known but significant marker of Alzheimer's disease. Research also links hearing loss or heightened sensitivity to noise to a higher dementia risk. Struggling to pick out voices in a noisy room or reacting strongly to loud sounds can strain the brain, accelerating cognitive decline. Untreated hearing issues force the brain to work overtime, potentially weakening memory over time. These sensory shifts are your brain's way of waving a red flag. Don't ignore them. Here's a surprising connection. The strength in your hands could reveal clues about your brain's health. Studies show that weaker grip strength in older adults is strongly linked to an increased risk of dementia. If opening jars, carrying groceries, or holding objects firmly becomes harder, it might reflect early neuronal changes. General frailty or reduced muscle mass can also amplify cognitive decline, as physical activity is a cornerstone of brain health. Exercise, from strength training to brisk walking, boosts blood flow to the brain, supports neuroplasticity, and helps protect against memory loss. If you notice muscle weakness creeping in, it's not just about physical strength. It's a call to action to keep both your body and mind resilient. Sleep is your brain's nightly reset, clearing out toxins and repairing neural pathways. But disruptions in sleep can be an early warning sign of dementia. Have you or a loved one started feeling overwhelmingly tired during the day, needing frequent naps? Or perhaps you've noticed restless movements during sleep, like kicking, punching, or talking, which could point to REM sleep behavior disorder, a condition linked to Lewy body dementia. Vivid nightmares, night terrors, or chronic insomnia, where falling or staying asleep feels impossible, can also signal trouble. Poor sleep doesn't just leave you groggy, it fuels brain inflammation, accelerating cognitive decline. Prioritizing 7 to 9 hours of quality sleep with a consistent routine can be one of the most powerful ways to protect your brain. If sleep issues persist, a doctor's evaluation could uncover underlying causes like sleep apnea, which deprives the brain of oxygen and heightens dementia risk. Have you ever seen someone lose their spark for life, the hobbies, conversations, or gatherings they once loved? Apathy, or a lack of interest in activities, is a subtle but significant emotional sign of dementia. Unlike depression, which may ebb and flow, dementia-related apathy is often persistent and unrelated to external events. You might notice someone withdrawing from social events, showing less emotion during joyful or sad moments, or lacking motivation to start daily tasks. This emotional detachment stems from the brain's struggle to regulate emotions and social behavior. It's not just feeling down, it's a neurological shift that can signal early cognitive decline. Recognizing this change early can prompt action, from medical evaluations to engaging in activities that stimulate the brain and rekindle connection. Struggling to find the right word during a conversation might feel like a normal slip, but when it happens frequently, it could be a sign of aphasia, a hallmark of early Alzheimer's. Imagine pausing mid-sentence, unable to recall a simple word like jacket, or mistakenly calling it a shirt. These language challenges can start years before a dementia diagnosis, with people repeating phrases, forgetting familiar names, or struggling to follow conversations. As these difficulties progress, communication becomes frustrating, often leading to withdrawal from social interactions. If you notice these patterns, don't dismiss them as just aging. They're a signal to seek professional advice and explore interventions. As dementia advances, its symptoms become harder to ignore, disrupting daily life in profound ways. Memory loss evolves from forgetting names to struggling with recent conversations, repeating stories unknowingly, or misplacing items in bizarre places, like keys in the fridge or shoes in the oven. Conversations become disjointed, with people losing their train of thought or repeating questions moments after getting an answer. Mood swings can transform a once cheerful person into someone irritable, suspicious, or even paranoid, believing others are stealing from them. Poor decision-making, like wearing inappropriate clothing or falling for scams, becomes more common. Disorientation in familiar places, like getting lost in one's own neighborhood, or confusing past and present events, can increase safety risks. Repetitive questioning, hallucinations, seeing or hearing things that aren't there, and, in later stages, loss of bladder or bowel control signal advancing disease, often requiring more intensive caregiving. These symptoms paint a picture of a brain struggling to keep up, but early recognition can make a difference. If these signs resonate, don't wait. Act now. Consulting a doctor can rule out treatable conditions like vitamin deficiencies, thyroid disorders, or medication side effects that mimic dementia symptoms. Early diagnosis opens the door to treatments that slow progression, from medications to lifestyle changes. It also allows families to plan for the future, ensuring safety and support. While there's no cure, you have more power than you might think. Engage in brain-boosting activities like learning a new skill, solving puzzles, or playing a musical instrument to build cognitive reserve, a buffer against neuronal loss. Regular exercise, like 30 minutes of walking, swimming, or cycling 5 days a week, enhances blood flow and supports new neural connections. A brain-healthy diet, like the Mediterranean or Mind diet, rich in berries, leafy greens, nuts, and olive oil, fights inflammation and nourishes neurons. Managing chronic conditions such as diabetes, high blood pressure, or obesity reduces dementia risk, as does treating sleep apnea or quitting smoking. Limiting alcohol also protects brain cells from damage. The horizon of dementia research is brighter than ever, offering hope for the future. Breakthrough drugs like lecanemab and donanemab, monoclonal antibodies that clear amyloid plaques in Alzheimer's, have shown promise in slowing cognitive decline in early stages. These treatments aren't cures, but they mark a significant step forward, giving patients and families more time to live fully. Scientists are also exploring gene therapies, brain stimulation techniques, and combination treatments to tackle dementia from multiple angles. While these advances are exciting, the most powerful tool remains prevention. Building cognitive reserve through lifelong learning, staying socially connected, and challenging your mind with activities like chess or storytelling can delay symptoms. Deep sleep, a consistent routine, and avoiding screens before bed help your brain clear toxins linked to Alzheimer's. Dementia may feel daunting, but knowledge is your greatest ally. By recognizing early signs, whether it's a change in gait, sensory struggles, muscle weakness, sleep disruptions, apathy, or word-finding difficulties, you can take proactive steps. Start today. Challenge your brain, move your body, eat well, and prioritize sleep. If you notice these signs in yourself or a loved one, consult a doctor to explore your options. At Vital Eternity, we believe in empowering you to protect your brain health and live vibrantly. Take action now, and let's build a future where your mind stays sharp, connected, and full of possibility.